In the UK, cases are soaring again, with daily infections rising to above 40,000 in the past 8 days. Yesterday, Britain's Health Secretary Sajid Javid warned pressure was growing on the country's National Health Service, but rejected calls to bring back restrictions.
This pandemic is not over. Thanks to the vaccination programme, yes, the link between cases and hospitalisations and deaths has significantly weakened, but it's not broken. So we must all remember that this virus will be with us for the long term and that it remains a threat. We're looking closely at the data, and we won't be implementing our Plan B of contingency measures at this point.
NBC News foreign correspondent Matt Bradley joins us now live from London. Matt, let's talk about that Plan B we just heard about. What does that involve, and why is the government unwilling to put it into action right now?
Yeah, guys, I mean, to be honest, that Plan B, it doesn't sound all that strict, especially compared to the really severe lockdown measures that we saw earlier this year here in Britain and throughout the world. Really, all it would involve are mandatory face coverings in some situations, vaccine passports, and encouraging people to work from home and communicating a need for caution. So still, the British government would still be pursuing mostly advising, mostly recommending that people take more precautions. They would be returning some of those mask mandates, the vaccine passports. You know, I was in Europe over the past couple of weeks in France and Germany, and there, where the case levels aren't nearly as high as they are in the UK, there's still quite a lot of restrictions, like mandatory mask coverings and things like that, that they really don't have here. If you walk around here in London, you'll notice that it's almost back to normal. That's because they've been relying on that highly successful vaccination campaign that the British government had been lauded for. But as you heard from the health secretary who spoke just last night, he was saying that there isn't yet what they call unsustainable pressure on the National Health Service. That's that wide safety net for all British people providing health care universally. That is the real metric here, because the deaths and the hospitalizations are creeping up. Deaths have not shot up to nearly the height that you would see, especially last year, that we saw when case levels were this high. So deaths haven't come to match that level yet, and that's why they're not really excited about implementing further restrictions. Of course, that's attracted quite a lot of criticism. Guys? Yeah, that makes sense, actually. Your cases may be going up, but if you have a highly vaccinated population, the serious infections and deaths would stay slow. So the UK's government, as you mentioned, heavily criticized by some over how it handled the pandemic. What are doctors and experts now saying about this latest decision? Do the public health officials want to implement this Plan B? Well, they're basically saying that this is deliberately irresponsible. And that's some of the language that we're hearing from doctors and some of the unions who represent doctors who work in the National Health Service. And, you know, this has really created a lot of anger here among the professional medical class. Among ordinary people, it's unclear, because a lot of people really do want to see the back of this pandemic. And while we did hear from government health authorities who said that the pandemic is still with us, there's this reluctance to implement further measures. And we just heard from the head of the British Medical Association. He was speaking. He's been speaking to a lot of media over the last couple of days. Here's what he had to say.
These are all figures heading in the wrong direction. I represent doctors, and what they're telling me, especially those in hospital, is that the pressures are really building up. We're seeing ambulances now queuing outside A&E, and it's not even the height of winter. So I'm not really sure what more we need to watch and wait for. Now is the time to put in place measures to reduce the spread of infection, and in fact, try and be a nation that can compare itself to what's going on in other parts of the world.
So what we've heard from a lot of doctors is that the government hasn't learned their lesson from the past 2 years, that when you delay harder restrictions, you just get more pain in the medium and long term. Guys?
Now, we understand the UK is also keeping tabs on rising cases of an offshoot of the Delta variant. What can you tell us about that? Is it as contagious as Delta, and are officials worried?
The short answer is that officials are worried, but that it's not necessarily more contagious or more damaging than the Delta variant. It's sort of a subgroup, a kind of a sibling of the Delta variant. It's called AY 4.2. It's already reached, as of late last month, about 6% of all of the viruses that have been, genomically sequenced. So it is threatening. It shows that the virus is mutating as was expected, but it's not necessarily going to lead to further infections or a more angry, more virulent virus. Guys?
Matt Bradley, live in London. Thank you so much, Matt.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.